You can appreciate that in a community like London, to have the number of children in the care of the Children's Aid Society more than double in a very short period of time, we had to ask some serious questions. What was going on and what were we going to do about it?
One of the things we knew from evidence and effective programming was we needed to be in the community, we need to mobilize strengths, we need to appropriately target, we need to actively do things to reduce violence, and we need to advocate on the behalf of people who are marginalized.
How do we build something that will allow families to feel they're not being judged, someone is really connecting with where they say they're having problems, and helping them to navigate a very complex social service world?
There's not one distinct factor. It's an aggregate of factors that's really conspired to challenge many families, and these include things like poverty, increasing levels of poverty, family violence issues, mental health struggles.
The families that were coming into the Children's Aid had 3, 4 problems sometimes, so they didn't fit nicely into one agency's mandate. What we wanted to do is say, what if we took a look at the family's needs? And then what if we said, what are the services they need, and how do we have to bring those services together in a way that works for each of them?
The major goal of the program here is to assist families to be able to care for their children rather than those young people ending up in the care of the Children's Aid Society.
So that was where we started, and that grew into Family Networks.
I'm a single mother of 3 children. I was in an abusive relationship for 8 years. I was miserable. I laid on the couch. I did nothing. I didn't even want to be a mother. I didn't want to be a wife. I wouldn't do dishes. I hated going grocery. I gained I was almost 400-pound girl because of it. And if I didn't do as I was told, I got smacked.
With the people we're working with are the people who are disadvantaged somehow, whether it's mental health, whether it's poverty, whether it's substance abuse, or a combination of everything.
My husband lost his job and things just went downhill from there. I worked as a volunteer for 5 years in a breakfast program, and from the time my daughter was in kindergarten, she's in grade 5, and I gave it up in March of her grade 5 year because I couldn't even make it to June. I had become my self-esteem, self-confidence, I don't know where it went, but it left.
This project deals with the whole family, so when they're looking at the family, it could be mom, dad, grandma, the cousin, mom's boyfriend. It doesn't matter who's in the house.
The first thing that we do is the facilitator contacts the family and arranges to meet, wherever they're comfortable, at the office, their home, or somewhere else. And the first part is that we just want to listen and understand for the family where their issues and concerns lie, get a sense of the agencies and supports they've had in the past, and what they are currently looking for. And as a facilitator, you have knowledge of the social service system, so your job is to begin to assess, the types of services that are available to the family, advise the family of those, and then coordinate a meeting with all the people that are involved so that everyone understands what's happening and how we're going to support the family. And together we draw up a plan of support.
What I've liked about this project is working with families who would otherwise have to turn to the Children's Aid or call the Children's Aid for help with things that aren't necessarily child protection issues, to have a different avenue.
So there were a few of us for about 2 years that worked on another project, and one of the things that came out of that project was this idea of a mentor. And that was the project that we've been able to actually take into the Family Network project. And in that project, I think we became so excited about that whole concept that even though that other idea kind of went by the wayside, when Family Networks came in, we thought, oh, would this be a wonderful contribution?
It's being that very much family-focused approach. And the mentoring component is very exciting because what they do is build that natural support system around the family.
We have an initial meeting with the family where the mentor, the facilitator, and myself will go out and meet the family. It gives the family an opportunity to see the person that they're working with, to meet the mentor, and that's the start of the relationship. And I think that's one of the key advantages of this project as well, is that it is about establishing relationships.
And then the mentors have their piece within that, in that they provide the very tangible, practical, day-to-day supports, the emotional supports for the family, and also taking them to appointments. So they make sure the plan gets implemented. And we make sure that all the players involved each take their piece of work on behalf of the family.
One of the things the mentor bring is the support for families. And when you talk to a lot of the families, that's what they say they want, whether it's emotional support. Most of it is actually emotional support.
I'm not used to having the support, and I like the support, and I like them. They're like my second family because they're there to help, you know what I mean?
These families have been touched by many agencies, and there's huge trust issues. So when you see that they're trusting you and obviously making gains, and to get them to be able to advocate for themselves where they haven't before, just to see their strength and growth within the family is really rewarding.
I think there is something powerful in having someone who maybe has walked a bit in your shoes connect with you and also let you know you can make it. You're going to be able to make changes. I've been through hard times, and I'm going to help you to get the support that you need.
The people who are the mentors have themselves come from challenges in their own lives, and they've really taken the extra step to help others in the community, and that's really the heart and soul of Family Networks.
I really feel very positive about Family Networks and the mentor team. The mentor team is an awesome bunch of people, fabulous stories, all of them, and it's neat because we do have stories, and we do have when somebody says, "Oh, you don't understand," oh yeah, we've been there, we've done it, we understand.
And the day that I met Paul, I was hesitant, kind of sat in my little corner and told him a little bit about me, and we met a couple times, and he told me about his situation. He was a single dad and doing everything on his own, so it was kind of nice to hear that there are other people out there like me.
I'm a single mom or a widow with 6 children, so some of them I have some similarities with them.
They feel more confident, more independent, more trusting in our project.
From Colombia, so I come from a beautiful but really hard environment.
And that's what's so great about mentors. They've walked a mile in our shoes. That's the thing, I think, it makes a difference.
We've had mentors who's gone to hospitals. We've had mentors who've been present for births of kids, right? We've had mentors who've gone to school appointments, who's had in with Children's Aid.
I just want to thank Family Networks altogether for doing what they did for me, because I'm a new person because of them, and there's not enough words to say thank you to these people.
I wouldn't have been able to do it alone. And the great thing about Family Networks is you never feel alone.
These are our community's children, and we all need to do something about this.
I think the best investment for any community is the families that live in the community. So, I think investing in Family Networks is investing in the future of London.
I cannot say enough how much it has helped me to realize I'm not alone.
If Family Networks had not been around the way they have, I'd probably still be laying on the couch. I probably would have been over 400 pounds, half dead, and I probably would have lost my kids.
I'd be still home, crying in the couch in the dark, doing whatever, struggling, if I hadn't connected with Family Networks 5 months ago.
So we're offering service coordination at a community level long before it gets to that high risk level. And that's where we want to support families kind of at the lower end of the risk level, so that we don't have kids going into the care of the Children's Aid because of the fact that needs weren't met over a progressive period of time.
This program is a bargain compared to what it costs to have children kept in care.
Our fear is that if we didn't have that financial stability behind this program through Family Networks, would we be able to maintain that for the community?
Family Networks represents probably the outcome of everything that I ever thought. Research, community-driven, passion, evidence, enabling families. Family Networks represents everything that one could hope to achieve in a community service, in a community's caring for children and families. And I mean that sincerely.